So I think we'll go ahead and get started then. Hello there and welcome. My name is Tyler Best and I'm one of the three Springboard community managers. Today's webinar, A Digital Epidemic, Managing and Mitigating Rumors and Misinformation, is presented by Springboard, an online community under the Breakthrough Action Project. Breakthrough Action is USAID's flagship program on social and behavior change. Breakthrough Action ignites collective action and encourages people to adopt healthier behaviors by forging, testing, and scaling up new and hybrid approaches to SBC. Starting with some housekeeping, today's webinar includes presenters speaking in both English and French. Please see here our friendly colleagues that can help you in case you need technical assistance. Note that although presentations will be in the presenter's language, we'll be sending out all presentations following the webinar in both English and French. We also hope to send out recordings in both languages as well. To allow everyone the chance to understand, we will be using simultaneous interpretation today. To enable interpretation, click on the interpretation icon at the bottom right of your screen and select your language. By selecting your language, you'll be able to hear the translation. If you are using a phone application, click Meeting Controls, select the three dots, and then select the language you want to hear. If this is your first Springboard webinar, then welcome. So what is Springboard? Springboard is an online community of nearly 4,000 SBC professionals from over 100 countries. Springboard can help you advance your SBC skills, connect with colleagues and SBC leaders, and get inspired through resources, events, and jobs. If you're not a member yet, join Springboard today. We'll be starting today's event with 4 presentations, followed by time for questions and answers at the end. Feel free to use the chat feature on the bottom of the screen to introduce yourself and organization. Additionally, you may use the chat feature to ask any questions for the speakers throughout the event. We'll compile those questions to use during the Q&A session. Now on to the show. Our first speaker is Dr. Amelia Brandt and comes to us from Johns Hopkins University, where she's a senior research coordinator at Johns Hopkins Medicine, as well as a research and evaluation officer on the Breakthrough Action Nigeria team. On to you, Dr. Brandt.
Thank you, Tyler, and thank you everyone for being here. I know for those of us on the East Coast, it's quite early. So as Tyler mentioned, I'll be discussing rumor dynamics and influencing factors during the 2014 to 2016 Ebola virus disease pandemic in West Africa. Next slide. And just to give a little brief caveat, this is work that I did during my doctoral studies at Tulane. So although I am with though I am with Johns Hopkins now, I just want to clarify that this isn't not speaking on behalf of my work there. Okay. Next slide. So just to start out, I want to clarify how I defined rumors in my research. There are a lot of different definitions, but the one that I chose is unverified and instrumentally relevant information that arises in context of ambiguity, danger, and potential threat that people use to help make sense and manage risk in those situations. And I think given the number of people here, I think we can all understand why rumors are a public health issue. But just a couple things that people may not know, rumors do influence health behavior, even if people don't believe them. They have been linked to violence, and they continue to be an issue, especially in outbreaks. And in addition to my work in Sierra Leone and Liberia, I saw that rumors continue to be an issue in that outbreak in the Democratic Republic of the Congo, and now, of course, continue to be an issue during COVID-19. So within the 2014 to 2016 outbreak, they were very common as well, often reflected mistrust of the response and the government, and sometimes led to patients being removed from treatment facilities, or those treatment facilities were sometimes attacked, as well as social mobilizers who were attacked and sometimes killed. So as a basis for my research, I looked at rumor psychology to give me sort of a foundation to work from. So from rumor psychology, I found that there were 3 psychological motivations that had been identified for rumor transmission and development. So one is relationship enhancement. So if you have information, you may share it with others so that you increase your social capital. Image enhancement, where you either create rumors or pass along rumors that make you look better. And then the third that I'll talk about more today is fact finding. And so fact finding is where you're in a situation where things are ambiguous or you don't have the information that you need, which then leads to a feeling of lack of control, increased anxiety, and then will eventually lead to rumor development and spread. So how that sort of works is you may have a little bit of information about a topic and you pool your information with those in your network to try to understand what's happening. So if you have heard 1 or 2 things, maybe you talk to your neighbor to see what they've heard and if they've heard the same things or if they've heard different things, to try to check the truth of what you've heard and try to create an understanding of a situation. So the first bit of my research that I'll talk about is where I looked at rumor chronology in Liberia. So for this research, I was looking at was there a potential association between trends in rumor content and the epi curve or notable events that were happening at the time. This was a multiple methods retrospective study, and the rumor data that I used was the program called Dosso in Liberia, which was actually implemented by Internews, which I know one of their colleagues is on today. And then I used newspapers and UNICEF situation reports to identify events that could affect rumors. So out of that research, there were a lot of things that came out, but one thing, given the time, I'm just going to be doing a very, just the highlights. So one thing that I thought was really interesting was an example of how fact-finding rumor development happened in action. So within Liberia, there was an ambiguous situation that arose where in June, towards the end of the epidemic, there was no more transmission of Ebola in the country, but somehow someone became infected with Ebola and it created a resurgence, as you can see all the details here. And so but what happened was that no one really understood how this person became infected with Ebola because there was no Ebola in the country. He had not left the country, and there was no reason that anyone could identify as to how he had become infected. So the response to that ended up being that a rumor emerged that the resurgence was caused because the index case ate a dog, which at first glance may seem to be very abnormal, but if you look at it more closely, it's actually quite logical. Even to this day, the resurgence source remains unclear, and people did know that the index case did eat a dog prior to becoming infected. And anecdotally, people saw dogs eating corpses on the streets or breaking into morgues to eat corpses, so they knew that dogs had been in contact with Ebola. And there was a lot of messaging early in the response about bushmeat being a source of Ebola. So logically, one could assume that if eating bushmeat can cause, I'm getting a little feedback, one could logically assume that if eating bushmeat that had been exposed with Ebola could cause you to be infected, eating a dog could do the same as well. And although the general public didn't know this, it is actually true that dogs can be a passive carrier for Ebola virus, but are unlikely to infect people. In any case, the CDC actually tested the dog carcass and found it negative for Ebola virus. So it seems that this rumor was untrue in this case, but it was a fact-finding response that was logical given the information that people had. Okay, and then quickly moving on to geographic rumor variation. So in this one, I was looking at how rumors vary between different counties in Liberia, and also use the Dosso program. And this is very formative research, so I really want to caution that I'm trying to make sense of information. It's very, very, I'm not basing it on existing theories as I did in the previous one. So just a little bit about Liberia. There are a lot of contextual factors to take into account. So I looked at culture, politics, and a difference in the outbreak experience. As you can see in this map, with the darker colors representing more, a higher number of cases, things really varied depending on where you were in the country. So your experience within the outbreak was very varied as well. So one thing that came out of the research was, you can see here, actually you probably can't see my mouse, I'm realizing, but there's a little kind of like a band of orange, where you can see that this is the most common rumor topic in each county. And there's this little band of orange where the most common rumor topic was Ebola origin. And so what I found from talking with key informants was that they thought that this may be most likely to there being a very active transport and transportation route between Montserrado and the border with the Ivory Coast in Bong. And then looking at the presence of specific rumors. So there were lots of rumors that the government was making profit on Ebola, but there were also rumors that humanitarian workers specifically, or that the president specifically were profiting from Ebola. And when I spoke, can you click again? Yeah, just click through until, yeah, okay. Oh, sorry. And so what I found when I spoke with key informants was that their understanding was that just if people had contact with humanitarian organizations, that was when people were more likely to have this, to have heard this rumor. And there is some basis in truth. There was a fair amount of corruption during the outbreak. And people did make a lot of money. Okay, next. And then looking at mistrust of Ebola facilities. Sorry, my cat is playing with a ball. So mistrust of Ebola facilities. This was common in a lot of different areas within the country. And so I looked a little bit at what could potentially cause that and found a few different theories from speaking with key informants. Can you click through? Okay, so part of it was the experience with Ebola. So if there were fewer cases, people tended to have a more negative impression, as well as if the EVD facilities became operational too late. So after the peak of the epidemic had already passed in that area. That also seemed to be more common in rural areas that had limited healthcare access, as it may have been quite a shock to, after having pretty limited resources, all of a sudden have this gigantic Ebola treatment center emerge. And within Lofa County, there was a specific issue with ethnic rivalries and where the Ebola treatment center was located within the county. And then finally, the organizational response. So for this, I interviewed EVD responders from Sierra Leone and Liberia about how their organizations responded. And again, I'm pulling out just very, very brief, very little pieces. So one thing that was really interesting from those interviews was when people would talk about rumors that had an element of truth, and a lot of different ones were identified, such as profit from Ebola, chlorine being dangerous, which it was necessary to avoid infection, but it also is a corrosive gas. So it did have negative effects on people's lungs and different things. And then another one was health workers unintentionally spreading Ebola. And so what people noted here was that you can't really reject or disagree with the narratives that people are making. You have to acknowledge the element of truth and go from there. And then another thing that was very interesting was how many people talked about organizational change as a response to rumors. It's usually thought of as a communications issue, but people brought up also that rumors are a really important way that people share information about their experience with something like an outbreak response. So a couple of the things that were mentioned were increasing family access to Ebola treatment centers and units. Early on in the epidemic, people would go to an Ebola treatment center and they would maybe never come back. And the families, of course, were not allowed to visit because of transmission risk, which of course then led to people wondering what was really happening because they had no information. And so over time, they were able to increase that access through allowing people to visit from afar or sharing information. And that helped a lot with reducing the amount of rumors about what was happening in the Ebola treatment centers, as well as there's a specific example of changes to the body bag, where people, again, because they were not sure what was happening to their loved ones when they went away, and then they would see these black body bags come out. And so there was a rumor that those were actually filled with rocks. And so they made part of it a see-through screen so that people could at least see the face of their loved one before they were buried. And then, so I looked specifically at one rumor in Sierra Leone, which was that health workers spread Ebola. And in terms of truth, 5 of the 9 participants that I talked to about this believe there was some element of truth. So not that it was something that was intentionally happening, but if infection prevention and control wasn't being done well enough, that it was a possibility. And it did have a lot of negative effects. So it decreased health-seeking behavior and it created a lot of stigma against health workers. And then in how this was addressed, the interesting thing was that people really talked about this being both something that had to be dealt with by organizational change as well as interpersonal and mass media communication. So people talked about the fact that you have to fix the problem that people are expressing through these rumors, as well as then communicate to them that, look, here's what we've done. Why don't you come see the Ebola treatment center, or can we tell you about the things that we do to keep people safe? So it was really a combination of communication and organizational change. So finally, just my caveat, this is about 200 pages of research broken down into 10 minutes. So there are a lot of methodological things and details that are not there. But I just want to kind of end with my thought that rumors are really important as they communicate needs and concerns that are coming from the community. So they're not necessarily a bad thing to be prevented. Sometimes they're giving you information that you need. And sometimes they're important because they're alerting responders of transmission risks. They can be very important to case identification. And sometimes they don't have a negative impact. For example, the rumor that Ebola was caused by eating a dead dog. Well, we don't really know for sure that much about transmission through that source. So maybe it's fine to hold off on eating dogs for a while. But if you do, some rumors are very damaging. So reducing ambiguity is the clearest way to reduce those. And then just knowing that the contextual factors that influence rumors and belief are important, but we don't really understand them that well yet. And then finally, that we still also really have a lot to learn about the link between rumors and how those really affect health behavior, because there are a lot of rumors out there and there are different levels of belief. And I think there's more to be found and there's more nuance there. So that is all I have. So I'll turn it back over to you, Tyler.
Thank you, Amelia. And please save your questions for later during the Q&A session, or feel free to start adding those questions to the chat and we will go ahead and compile those. So thank you again, Dr. Brandt. And moving on to our second and third speakers, we have with us today Abdul Dosso and Natalie Tibbels. So Abdul is the Research Monitoring and Evaluation Manager for Breakthrough Action Côte d'Ivoire, and Natalie Tibbels is a Monitoring Officer for Johns Hopkins Center for Communication Programs. Over to you, Abdul and Natalie.
Oui, en fait, notre présentation qu'on aura fait porte sur la gestion des rumeurs.
Thank you very much. Our presentation concerns managing, mitigating rumors and misinformation. We have 2 sections. The first part, which is the system that helps us do the managing of these rumors, and the second part with the mitigation, thanks to the system. Next, please. Next. Okay. I just wanted to thank you. This is my first presentation here in Springboard. So thank you very much for your opportunity. And thanks everyone for participating in this session. My name is Dosso Abdul, and I am the responsible manager for CCP in Côte d'Ivoire. And it is the center of communications programs for Johns Hopkins. And we believe that through the communication, we can save lives and we can allow population to adopt healthy behaviors for them, for their families, and for their community. CCP works on SBC programs, and in Côte d'Ivoire, we work in different components on HIV, family planning, malaria, and GHSA. Next, please. So concerning the global health security agenda, we speak about risk communication. And through this platform, GHSA, and I think we have about 70 countries included. The goal is to help countries detect and respond to infectious diseases and the threats of infectious diseases. We are trying to respond to emergency situations and doing so through the behavior change at a household level, but also at the community level. The risk communication is a component that is very important for rumor tracking. And when we have an emergency situation, there are many rumors that start disseminating, and they can have an impact on each individual. Next, please.
OK. Donc, justement, comme je disais, il y a pas mal d'informations qui peuvent circuler.
So many information can start being disseminating, and the rumors will have an impact on behavior. And they can also have a negative effect on the response, for example, for the public health response. An example that we all know is the case of COVID-19. When COVID-19 started, we didn't have all the means for prevention, and the acceptance of COVID wasn't there in our communities. So there were rumors in our communities saying that COVID-19 didn't exist, that it was just an idea of the West, so that they could explode Africa or any other countries. And as you know, this has an impact on the behavior of the communities. So in our work, we have defined rumors, and for us, rumors are informations that can't be checked or they're wrong in a community. And it starts when there is too much information, or where there is a lack of information, or there is information that is not reliable. So, for example, in our COVID-19 example, that was something very new. No one knew what was happening. So there was too much information, and there were information saying that the disease did exist, and then information that said that it did not exist. So too much information. When the rumors are shared, the rumors can also start changing. There are some people that try to add things to the information that they think are useful. And they have a sensation of having control in moments of stress. And also there is the intention of giving wrong information so that they can earn money or just for policy goals. Next, please. Next. Thank you. Here, we are going to speak about the system of rumors that we have. So the idea was to inform about the messages of SBC through the rumors that existed locally, that were disseminating within our communities, so that we could prevent the information that could prevent against vaccination on other zoonotic diseases. So we have a database that was hosted in the cloud. I said host in English because I don't know how to say it in French, but so we hosted this in the cloud, and the idea was to analyze the information. And once we analyze the information, we share the information so that we could take action and correct this rumor. So the system can work also in a context that is not a pandemic and can be very easy and rapidly activated, enabled when we have an emergency situation.
Gestion des rumeurs, on n'avait pas encore la COVID. D'accord? Donc on
We didn't have this system when COVID-19 started. So what we did is that we adapted the system we had for zoonotic diseases, and we adapted it for COVID-19. The system also is centered on community sources that already exist here in Côte d'Ivoire. We have centers that are already, for example, hotlines, and we are, so we have the support of hotlines and also informants that are already in the community and that are our relay or liaison, so that we could understand what were the rumors that were disseminating in the community. We all know very well that there are many rumors that were disseminating through social media. So the system also allowed to collect information from the social media so that we could take and make decisions based on them. Next, please. Okay, so our system was a digital solution, and they wanted to develop the digital principles. So we were respecting all the stages. And we had the possibility and the choice to use platforms that already existed, like Codification or Kobo, that already existed. But we had to take into account the fact of knowing if this system was going to last throughout the time. So we have created this web platform that is open source, and we can develop our system, our program, so that we can use them at all levels. And the system was used locally already in Côte d'Ivoire. So that's why it guided our decision to use DHS2. Next, please. Next.
OK.
Okay.
Je présente ici,
Here, I am presenting this system of rumors. So we had the collection part. The collection part were three groups. We had the people that were calling the hotlines. The system integrate a system that already existed. So we had callers that were calling the hotline so that they could learn more information about zoonotic diseases, for example, and they would give information that was identified as rumors, and if they were identified as rumors, they were collected in the system. Then we had informants in the community, and they were telling us the rumors that they were hearing through their families, through the neighborhood, through the community, and that they were also integrated in the platform so that we could also get those rumors, and also through social media. Another aspect is to integrate the information that we got through different polls. So via this DHS2, we have a code. We do it by topic, and there's a team that's doing this code by topic. Then we do the analysis of these rumors, following the beliefs and the topics. Once we have finalized the analysis, we share the analysis and we communicate them so that we can address the rumors, or we can address also the misinformation that is circulating in the communities. And then the decisions are transferred to, for example, radio spots, or we create messages, communication, supports, or we do some community groups. For example, if we want to, so that's why if we want to give the facts to the community. Next, please. And here, I have a slide to present how we had this collection, but we can go to the next slide, please. Next. Okay, so we also took into account in our system of some ethic principles, and also our system had limits. So for the ethics part, we did not take the information that would enable us to identify who was spreading this rumor. So, for example, when we are collecting the information, we won't say Dosso said a rumor. No, we were just collecting the rumor, not the person who was spreading the rumor. We were not identifying people personally. Then we had also limits. The system is not representative of the whole population. That was a limit, a very important limit that we have to highlight, because these are rumors that we hear within the community. So there is a lot of information concerning the rumors, the misinformation, the wrong information that is disseminating, but it's not representative of the whole population. And also the system was not designed for an individual follow-up. So it was mostly for beliefs and rumors. So we're going to see how we were able to follow the rumors individually. Next, please. I was speaking about the rumor analysis, so the code and the synthesis that we do. So what we do is that we identify some topics. So that's how we do our code, our coding. And what is very interesting is that we can follow up some general topics and we can do some reports. For example, information about COVID-19. So we can follow up the evolution of these topics through the time. There is also the declaration of conviction that is also the result of the synthesis of all this data. And also we have the responses so that we can establish a priority when we are taking action. Next, please. Here, we are presenting how we are using our system DHS2. Next, please. Here, you have our dashboard, and here you can see the rumors that were integrated in the system. So for this period, I think it was 3 last months, it was 156 rumors that were collected. Next, please. Here, we have a code that we did. And as you can see here, we can see groups by topics. And here we can see, for example, that rumors say that health centers and testing COVID-19 centers are the places where you get infected by COVID-19. So this information is information that speaks also about treatment and test about COVID-19. So we had many information created about this topic, and there were also other rumors. Some, I think a key informant was saying that they say that the government is increasing the number of cases confirmed of COVID-19 cases so that we can have more resources from WHO. So they say that we don't have that many cases of COVID-19, but it's the government that is just increasing them so that they can have more funds from WHO. Next, please. Here you can see we have many different groups that we have about different topics, about different rumors in the community. Next, please. I think I don't have a lot of time left. So here is just a dashboard, different dashboard by topic. Next. Okay, it's the same. It's the same dashboard where we have a table and we can see different words that were submitted to the dashboard. Next, please. So here for the use of data, this system helped us use the data so that we have a positive feedback from users. The idea was to have a system that helped us take action. And integrate this information into the community. So we created, for example, different products about, so we had these weekly documents that spoke about rumors, and we were able to create different flyers, different posters about COVID-19. We were able to create videos about COVID-19 so that we could respond to different rumors that were disseminating within the community. We were also able to integrate community leaders in our activities, awareness activities. So the role of community and community leaders were very important. There were some rumors that they were saying that community leaders were not speaking about the topics, so that's why they were fake news, or and that helped us actually include more the community leaders in our activities for COVID-19 prevention. Next, please. And I will stop here, and now Natalie will be speaking about considerations and lessons learned. Thank you very much.
Thank you, Dosso. Go ahead, Tyler, to the next slide. So Dosso gave you some details about the system that we've created, highlighting the Côte d'Ivoire system, but also showing some screenshots from systems in other settings where we've applied more or less the same approach. And the bottom line is it's not so simple a process to take a lot of unstructured data, process it rapidly, and act on it. And so that's what we were really trying to do here. We know that risk communicators and partners doing community engagement benefit from a low cost and rapidly scalable system that can do that processing of contributions from various sources in order to generate insights into misinformation and community concerns during an outbreak. So in order to say that the system is doing what we want it to do, we need to input unstructured data and pull out insights and decisions. Go ahead to the next slide. So through this process, we have been able to adapt the system that started in Côte d'Ivoire to several other CCP settings. So versions of it were done early on in Eswatini, Guyana, and South Africa. And my colleague Busan is on the call today, so shout out. And then now Mozambique, Uganda, Cameroon, and we're kind of just seeing how this can play out in different places and be supportive of the emergency response. We have worked with within Breakthrough Action to prepare Breakthrough Action, Breakthrough Research to prepare several guidance documents, as well as a DHIS2 metadata package to share with our own teams, but we've also made it freely available online for others to use the system as well in their own configurations. Next slide. I wanted to acknowledge other organizations that we've learned from. I'm very excited to hear the presentation coming up next, because we've learned so much from Internews, IFRC, UNICEF, and others. You can see here the WHO's City Beats dashboard, which relies on social media data for COVID-19 for a few pilot countries, and then the IFRC dashboard for community data on COVID-19. So these are all just kind of organizations we've learned from along the way. So going on to the next slide, there are a few reflections and kind of lessons learned that I want to share through this process. Next slide. First, just want to reiterate something that Dosso talked about, which is that a rumor management system is not only the technology, nor is it only the rumor contributors or the rumor data itself. It's this whole package, start to finish, of people who listen and contribute rumors, partners who contribute secondary data, unstructured data that they have collected and maybe haven't had the resources to process. Could be an open-ended question as part of a survey or SMS or IVR systems. It's also the database, it's the data management procedures, it's the human minds that analyze and identify problematic rumors rapidly. And then it's the group of government and NGO partners and local community leaders and community members who address rumors through risk communication and community engagement. So each element of that process requires investments. If you really want to do this well, mostly investments of time and partnerships, but also financial and human resources. there is that initial investment in infrastructure and capacity that's required. The data analysis software, training, identification of community contributors, kind of training on what a rumor is, what types of rumors are reportable. So we've been taking a phased approach in these different settings, beginning with, a couple rumor sources or limiting the geographic scope to ensure that the system is appropriately tailored to the context and is sustainable, and then adding as you go along. But planning and budgeting, both to rapidly scale the system and for all these different components, really avoids pain later. Next slide. So having made the point that the system is not just the technology, still choosing a software platform is really important. So within the Breakthrough Action Project, we've used Google Suite, IVR systems, but mostly worked with DHIS2 for this rumor tracking approach. And it's been useful, for example, in countries that use DHIS2 as their national HMIS system, because there's a pool of qualified people who can help manage the system, and it ensures complementarity with existing systems. DHIS2 is built on a geographic hierarchy, and you need to decide pretty early on how you are going to geographically localize rumor data. Dr. Brandt alluded to this in the first presentation, that rumors can be widely spread or they can be very localized, and it helps to nuance the response to be able to track this a bit. And DHIS2 is a good system tracking level or national level. The bottom line in choosing a software platform, as Dosso really emphasized well, is to ensure that you align with the principles for digital development. Do a landscaping assessment to find out what already exists and where, or if, a new system can actually fill a gap. Build for sustainability and shared ownership. That is critical at every level. To incorporate rumors from existing platforms, use software people know, to not reinvent the wheel with something that seems cool but actually isn't usable long-term. Open source, low-cost options, those are all really important. So it's not only DHIS2 that can do this, DHIS2 is a good option, but those principles help you kind of weigh your different software options and choose something that's going to work for your setting. Next slide. So we have pulled rumor data from many different sources. In Côte d'Ivoire, for example, we're now starting to work with radio hosts and other journalists, as well as ramping up our social media, social listening piece. But we really started with those local community contributors who submitted misinformation they heard via WhatsApp, and then the national hotlines that already existed. So as Dosso pointed out, he showed those two word clouds. A sort of informal comparison suggested that both the community contributors and the hotlines identified more or less similar misinformation circulating in the country, but the community contributors tended to provide more detail, more context, more nuance, which aided analysis. So that's there is a benefit of having those community voices who are trained to understand, recognize, and report rumors. The system we're working on right now in Mozambique is pulling, for example, exclusively from hotlines and SMS and online surveys, but it's processing and collating the unstructured data that is often overlooked and turning that into actionable insights. So we're also kind of ramping up our social listening approach, as I talked about. Some is manual. In some cases, we're asking our community contributors to report rumors they hear on social media. In some cases, we're pulling, for example, from the Facebook API and reviewing, we have a dashboard of just Facebook posts that using certain keywords that we can review. And very recently using topic modeling to try to identify new rumors using machine learning. So there are pros and cons to relying on social media data. It casts a broader net. It can be more readily accessible. It doesn't require, human contact in some ways. But it can miss people who are not active users of social media. And so social listening is a growing field. There's a lot of buzz around it, but there are a lot of ways to listen to and dialogue with communities aside from that. And I think that's what we've really shown with these systems. Next slide. So that top was kind of thinking about how you set up your system. Now, as you're using the system, I want to emphasize what Dosso said. It is so important to understand and explain what is the purpose of the system as we've designed it. We're not attempting to trace a rumor back to its source and punish or persuade the person who started it. We refer the case surveillance and event surveillance, reports of outbreaks or cases to other responders. For us, this is a social behavior change tool for a social behavior change response. And we want to have this continual snapshot of where communities are, to have a mechanism for this two-way communication, to quickly identify potentially damaging misinformation and nip it in the bud. So it's not represented the way a survey would be. It is fundamentally a rapid qualitative process. And it's one way for local communities to voice concerns in order to inform risk communication. And that kind of influences how you think about the volume of rumor submissions that you need. How many rumors do you need to have sufficient scope to be useful, but remain realistic from a data management perspective? Do you need hundreds a month? Do you need thousands, tens of thousands a month? Because we've been working with trained community listeners who know how to recognize rumors and misinformation. The submissions really are higher quality and more relevant. So in that sense, we don't necessarily need 100,000 submissions a month. We could have hundreds of submissions a month, and that really does give you a window into a particular set of beliefs. But we also only had contributors in certain regions. So it becomes a question of kind of how do you maintain the rigor and the scope while scaling approaches that give you the best insights. Another consideration on this kind of understanding the limitations is just how dashboards and the approach we take to coding, not just CCP, but WHO pilot and others, produce visual objects like charts and graphs that can lend themselves to misinterpreting the type of data we have. We have qualitative data that we are organizing and tagging into topics. And so if you're seeing 10% of submissions, this month relate to the theme of COVID-19 denial, believing that COVID doesn't actually exist, what does that 10% mean? Does it mean 10% of the population doesn't believe in COVID? Of course not. We haven't sampled. We're only looking at these specific sources of rumors. And moreover, answering the question, what proportion of people don't believe in COVID, is not the purpose of our system. So we do the topical coding and the charts to organize data, to look for sudden spikes in a particular topic that might signal a rumor that needs to be investigated. And so this issue of kind of how we're sort of quantifying unstructured data, it becomes really important to explain on dashboards, during presentations, just all the time, how the summary data should be interpreted and used. Next slide. One helpful aspect of kind of understanding where the system fits into the larger ecosystem of rumor management is that triangulating rumor data with other research data is so important. One element of this is during formative research when you're defining your codes. How do you reduce the totality of human experience and perceptions toward a particular health issue down to like 20 topics? That seems really hard. Health behavior theory can be helpful. For example, for an infectious disease topic that you're including in your rumor management system, you typically want to include perceived severity and perceived susceptibility as codes. The extended parallel process model suggests these constructs tend to be important. Who is at risk and how bad is it if you get it? Formative research can give insights into other potential topics. So in Côte d'Ivoire, for example, we had done formative qualitative research on determinants of behaviors related to Côte d'Ivoire's 5 primary zoonotic disease groups. So that gave us a place to start on what types of behaviors and topics might arise. There's also an inductive process where you're adding topics as they emerge from the data itself. And that's the benefit of a cloud database and kind of that dynamic real-time monitoring approach to this whole thing is you are responding to the data and you're organizing it and analyzing it as it comes in kind of on its own terms. So not only beforehand, but then during the rumor tracking process, triangulating with other data sources is important. People are doing surveys, qualitative studies, other types of research, and that can dialogue with your rumor tracking data to confirm, to nuance, or even to track changes in these rumors over time as a result of your risk communication and community engagement. So finally, excuse me, I want to emphasize the importance of coordination between the implementing partners under the oversight of the relevant government ministries to ensure that rumors and misinformation are not just collected and identified, but addressed. Ministry of Health and Animal Health teams can actually do the event surveillance, going and investigating, any cases or things that come through the system about, outbreaks, things like that. Different partners have different risk communication and community engagement strategies, but aligning and harmonizing the messages, making sure not to restate the rumor, but communicating truthful, transparent, and credible information that speaks to the topic of that rumor, all of that requires strong coordination. This is an area where the team in Côte d'Ivoire really excels. William, John, and that whole team on the call right now, just really impressed with how they've been able to handle the coordination and the load that goes into this rumor management approach. Dr. Brandt talked early on about addressing rumors not only through messaging, but concrete changes in the operational response, such as the example she gave of changing the body bags during the Ebola response. And that kind of change does require substantial coordination, but it can have a huge impact on the response. So for us, documenting the response to rumors has probably been a more challenging aspect of this process, but it's so important to ensure that misinformation is continually considered and addressed as part of the emergency response. So thanks so much to the Côte d'Ivoire team, the Breakthrough Action team, and to Springboard for hosting this.
Thank you, Natalie, and thank you, Abdul. So our fourth and final speaker here today is Irene Scott. Irene comes to us from Internews, where she is a senior humanitarian community engagement project manager. Over to you, Irene.
Great, and thank you for having me. Yes, my name's Irene Scott. For the last 6 years, I've been working to understand rumors and how they impact decision-making, both within communities, but also for aid workers in humanitarian response. Before then, I worked as a radio journalist and presenter, another field where sorting fact from fiction is pretty critical. So it's wonderful to see in this pandemic increasing interest in the concept of rumors. It's really such a vibrant and emerging field, and I've really loved listening to the other experienced speakers already today. Next slide, please. So mid last year, Internews launched a project called Rooted in Trust. What we wanted to do was to collect and to analyze rumors around COVID-19 and to support humanitarian and health partners and local media to respond to those rumors. So as you can see from the countries on the screen, we have been working in lots of very different environments, and we were also working with very different vulnerable groups. So in some of those environments, we might have been working with migrants or with refugees. We've also worked with LGBTQ communities. We've also looked at women and the gendered impacts of the crisis and linguistic minorities. Over the last year, I feel like we've learned a lot more about rumors. There's a lot more to learn, but I did want to use this conversation with you all and this presentation to share some of those common lessons that unite these very disparate locations where we've been working, and hopefully they'll be helpful where you're working as well. Next slide, please. Okay, so the first lesson that we've learned from our work is it's not them, it's us. So I wanted to start by addressing what I see as a really common misperception in rumor management, that rumors are shared by other people. If this pandemic has taught us anything, it's that everyone, you, me, the world's leading scientists, do not have it right all of the time. We can be the rumor mongers. We have all inadvertently shared misinformation during this pandemic. I'll own up to it several times. Information is flowing and changing so rapidly, it's completely unavoidable. But why does this matter? Why does it matter if we're also liable for what's happening? I think in our project, we've learned that a key ingredient to addressing these rumors is empathy and forming an understanding of the many factors that might lead someone to believing and perhaps sharing a rumor. The approach of we have it right and they have it wrong doesn't really help anyone. It builds a division between you and between your community. And that kind of mindset will also bleed into your approach to responding to the rumor. Do you approach it with understanding, speaking on the same level as the community, or approach it as a distant authority figure who knows everything and never gets anything wrong? And I'll talk a little bit more why that matters in a moment. In our experience, we've also found that conspiracy theories are a very small part of the rumor ecosystem, but one that receives a lot of attention. Of course, media love them. They're the crazy conspiracy theories that people want to hear about. And this is not to say that conspiracy theories don't have an impact. They might have a small amount, but they can have a big impact. But in every location where we worked, we recorded conspiracies. Sure, some shared fears that the vaccine would be tested on their community or would in fact kill them. Other theories were that the school vaccination programs were designed by the authorities to infect their children with COVID, for example, or that the pandemic was in fact a plot to overthrow an entire government. Interestingly, though, we saw very little impact to the major conspiracy rumors that hit the headlines in Western countries. So very few people in the countries where we were working were talking about things like 5G being to blame for COVID-19. And that's really no coincidence that 5G is not available in many of the countries where we were working, and rumors do fit to people's context, to their worldview, and they can adapt to their context and change, as well, as we heard from one of the previous speakers. One example that we saw in our data was, for example, a rumor that emerged in Indonesia about a baby that was born that could speak as soon as it was born and told everyone to eat a boiled egg before midnight to avoid COVID. And so that rumor was circulating in Indonesia. We saw a couple of days later that it popped up in Thailand, and suddenly that baby was now a Thai baby. It was speaking a different language, of course, as well. And there were other cultural aspects that started to bleed into this rumor as it moved around Asia. When it arrived in Vietnam, now the egg had to be red. So these rumors were moving and fitting with people's context as they went and were shared around the region. A week and a half later, we saw it pop up in Uganda. So that was one that it seems very unlikely, but somehow worked its way around the world, constantly adapting to the different environments that it was in. Earlier this year, we also analysed rumours that were shared by health workers. So we've heard about some of the different rumour systems that you can set up. In the one that we've been using in Rooted in Trust, we do tag if the rumour that we've collected is shared by, say, a politician or an authority figure or a health worker. Otherwise, all of the information is anonymised, as we're hearing is so important. So we wanted to kind of understand what were the rumours that were being shared by health workers, not as an attack on health workers. They have an incredibly difficult job in this pandemic, but really to try and understand the trends that we were seeing in different countries and to understand whether there were different reasons why healthcare workers might be sharing misinformation. We saw in Lebanon, for example, that a lot of the rumours we were collecting from health workers were shared by quite high-profile doctors, often with opposition party affiliations, and they were sharing rumours to discredit the vaccine itself and the vaccination process. So there was a definite political angle to why they were intentionally sharing that disinformation. But for example, in Afghanistan, it was a very different situation. Most of the rumours that we were collecting that were being shared by health workers were actually being shared by community health workers and local doctors. We found that not only were they some of the most trusted sources of health information, but especially early on in the pandemic, they didn't always have the best information. Everyone was still trying to work out what exactly this pandemic was. So they were relying on their existing health knowledge that didn't always line up exactly with the COVID pandemic and with the virus itself. So that was much more unintentional sharing of misinformation, shared to try and help out the community, really. But these findings were mirrored right across our data, I would say. Disinformation is definitely there, but the majority of rumours that we were collecting in the locations where we were working were legitimate questions and concerns or legitimate criticism of responses in the countries where we were working. They were mostly people seeking information or people sharing information in the hope that it would help their friends and their family, even if that might have been, misguided, or people just trying to make sense of what has been a very confusing experience for everyone in the world. I think we could all agree. And the way that we make sense of new experiences, the way we try and make peace with that when we're feeling like a fish out of water, when we're feeling like our whole world is changing around us and it's very much out of our control, we try and ground that in something familiar territory, in something that we already know. So finding comfort in that familiar. And so that's overwhelmingly why we believe that the main rumours that we're collecting in all of the 7 countries where we're working, mostly for most of the pandemic so far, did relate to treatments and cures. Often those treatments and cures were based on religion, on culture, on traditional approaches to illnesses that were perceived by the community as similar to COVID-19, so treatments to the symptoms of coughs and colds and flus and things like that. And so that's the community not trying to share misinformation necessarily in a way to harm each other, but trying to share information in a way to help each other and to make sense of a situation, trying to grasp onto what they do have to do something about this very new situation that we're in. Next slide. The second big learning I wanted to chat about was about the communities that we work with. It can sometimes be really easy to be lost in the data and the complex analysis of thousands of points of perceptions. But rumor management really shouldn't be a big academic process. It still needs to be grounded in the communities, and the communities need to be at the center of everything that we do. We're not doing this just to publish a paper. We're doing this because we want to affect some sort of a change in the communities where we're working. So step one of that is understanding your community and their information ecosystem. So in our project in the 7 countries where we're working, we did something called an information ecosystem assessment, and I'm happy to share all of those with you. They're on the Internews website. What we wanted to understand was how people access and share information, what platforms they use. For example, when we're thinking of social media, in Lebanon, older Syrian refugees don't like to use Facebook so much. They prefer to send voice notes via WhatsApp. Younger refugees might use Facebook. So we wanted to understand not only what platforms people might use online and offline, but also who uses them and for what. So people might use, for example, one platform for engaging with friends and family, or another to chat about politics or health issues. We really wanted to understand to that, really minute detail how different sectors of the society share, access information, and of course, who they trust and who they don't trust. A big thing about really understanding this information ecosystem is to try and prevent us from making these generalizations, like all refugees do this, or all refugees love this media outlet, or everyone in this country is vaccine hesitant. We wanted to really try and get down to that more granular level to understand which sections of the society have particular preferences and how we can adapt our program to make sure we're fitting those preferences. An important thing of that is working with the community. So I think we've heard in the other 2 programs already that it's been a really key part of their approach as well, is that if we're going to have any chance of collecting the data that we actually want, and if we're really going to be able to genuinely understand it and design responses that are effective in the communities where we're working, we need to really involve the community in those decisions. So that can be as simple as hiring local teams and building that local rumor management capacity. So making sure that people collecting the data are from the community that you're interested in listening to. And when I say community, it's also about us thinking about whether our teams are diverse. Have we only hired young university educated people? Have we hired older people, younger people, people living with disabilities, people from different religious or ethnic backgrounds? The more that we have diverse teams, the more likely we're able to capture that diverse data that we want to listen to. Another key thing that I think we learned and something we've seen right across this pandemic is how important it is to support the existing platforms. So to go where people already are. There's nothing worse in the middle of a crisis of telling a crisis affected population that suddenly they need to go to this new webpage or this new Twitter feed or this new Facebook group when they already have places where they trust and out of habit go to source their information. So to try and not overwhelming people even further, what's really important in this analysis of understanding what people do in their community is taking a look at where people already go to get their information. And it might not be the people who you think. It might not necessarily be the community leader. It might not necessarily be WHO or even the Ministry of Public Health. It might be a local comedian. So for example, if you're working with a younger population, perhaps that local comedian is actually who they trust or actually who they go to for information or are more likely to interact with. So keeping your mind open to who those information sources might be, listening to the community about who they already go to, who they trust, where they get their information, and trying to support those sources to have the information and the tools that they need to then support their community. That's really critical as well. So making sure we kind of keep our mind open about who those information sources can be and not writing people off just because they might not necessarily fit the common mold of a public health responder. And what's really key in this as well is to keep listening. So once we might have used, for example, that comedian to share the information. One example we have is when we were working in Sudan, we worked with a really popular comedian there to make some videos around misinformation that we'd collected in our data in Sudan. And for me, sitting here in Melbourne in my small office, those videos to me were not funny at all. They didn't fit my reality. They didn't fit my culture, my background. To me, they didn't make sense, but they were so well received by the community in Sudan and by young people in particular who we were trying to target. And so making sure as well, if you're not from that culture, as I wasn't, to be able to step back and again put the community at that center and say, well, what do you think will work, is really critical to make sure that we are genuinely creating things that feel to the community like they are speaking to them and feel like they fit with their reality. Once we've done that as well, is to keep listening. It's, I think, one challenge I would say that we've combated quite a lot in this pandemic is the overwhelming feeling that once you've addressed a rumor once, so I've made a tweet, I've made a video, I've spoken to the community about this rumor, that you're done. And if that rumor comes up again, well, yeah, I've already addressed that, so I don't need to address it again. I think what's really important in our approach in particular, and what we try and encourage, is that, sure, address the rumor, listen to the response, and keep tracking it. If that rumor continues to circulate, have a think about perhaps whether there's a different approach that you could take. Perhaps it's a different platform, perhaps it's a different person to deliver the message. But many of these long-held beliefs are not going to be changed with one tweet. So commit, try new things, and don't stop listening to rumors just because you feel like you've already addressed them. Look to local media. Internews does a lot of work with local media in the places where we work. I would say they're not always the most popular people to work with. Some organizations are very uncomfortable working with local media, and that's fine. Of course, local media isn't perfect. But what I would say is in our work in the 7 countries so far, what we've heard from local journalists is that they feel really demonized by the public health response quite often. When they call humanitarian organizations for information, they struggle to get through, no one answers the phone, or they're diverted to perhaps head office in Geneva or New York or somewhere very far away where someone doesn't necessarily understand their very hyper-local context, or perhaps doesn't even speak the language that they would prefer to discuss these issues in. We've seen a lot of big regional press conferences where wonderful information is shared, but only really large major media get to ask questions, or that they're held in, of course, dominant languages like French and English and Spanish, which doesn't necessarily, again, address the needs of more local journalists that might not prefer to speak in those languages. And language is a really key thing. I think we're all struggling to keep up with the evolving science of COVID-19, but do pay a thought for the local journalist who might not speak a major language, who's now trying to understand really complex scientific information in a language that isn't their preferred one. So if your organization has the capacity, and we would encourage you to, is try and work with local media, try and help them move beyond fact checking, simply identifying rumors as right, wrong, or somewhere in between. Work with them to understand the behavior change approach, to understand the beliefs and the motivations that might be fueling the rumor, and to use their reporting to address some of these ideas. Local media often has a very big and very committed audience. Teach them to report rumors into your system. We heard just from the previous speakers that they're working with local media, teaching them to recognize rumors, and those rumors are then being reported into their system as well. Local media are a perfect outlet for that, and they can collect rumors for you and be part of your rumor management system as well, and feel like they're part of the solution. So they're not perfect, but they're also not always the enemy. So think about what you can do to help them be better information providers for their community. Next slide. Okay, so the next lesson that we learned from our project was where you listen really matters. So during COVID-19, we've seen an increasing reliance on social media listening to understand what people think about the pandemic. So marketing companies who once analyzed social media to understand what people wanted to buy, or maybe what TV show that they liked, have now pivoted to deliver analysis to inform a global health crisis. So this information is wonderful and can be used to understand perceptions and inform responses, but there are a few really big reasons why we're a little bit concerned about some of the ways that social media listening is being done in the pandemic, and how that it might actually be drowning out some of the more vulnerable voices. So one of the first reasons is the digital divide. I think we all know that not everyone is on social media. So of course, any form of social media listening is never going to be representative of what everyone thinks in a country. We need to really recognize our limitations there. One of the other reasons is approach. Most techniques that we see rely on scraping or casting the net really wide to gather all publicly available social media data and then to analyze it. So it could mean collecting keyword mentions of COVID-19 on Twitter. That's mostly all public information. Or it could be public groups or pages on Facebook, for instance. But public profiles are generally people with a profile already. So they're businesses, politicians, the media, celebrities. So again, from collecting from just these places, we've already split the population even further, and we might end up with quite a lot of data, but it might represent a very narrow portion of the community. So I think as was said by Natalie in the previous presentation, necessarily aiming for huge amounts of data is not necessarily the path to genuinely understanding the rumors that are circulating in your community. Smaller amounts of high quality data can be just as, or if not much more, useful. So in the Rooted in Trust project, we wanted to be able to listen to really specific vulnerable groups via online and offline techniques. So in traditional social media listening techniques, we were really worried if we used those that their voices would be drowned out. One of the things that we found in our research was that the vulnerable groups that we wanted to listen to used social media in quite distinct ways that might not be represented by the rest of the community in the way they use social media. So, for example, in Afghanistan, we really wanted to listen to women. And many women in Afghanistan, as you might know, don't have access to social media. But for those that do, they're more than likely in Kabul or one of the largest cities. And they may use pseudonyms or only friend other women, creating these closed circles where they feel safe to post and discuss things. In Lebanon, for example, I mentioned that older Syrian refugees might use voice messages on WhatsApp, whereas younger Syrian refugees are members of closed Facebook groups that are only open to refugees, and they're used to discuss refugee issues, also including COVID-19 as well. Or in Colombia, we were working with LGBTQ plus migrants who didn't feel safe openly communicating about their status online. So everything that they do is done in closed WhatsApp groups or other encrypted forums. So for all of these groups, if we used an open scraping approach, they would be completely missed in that approach to social listening, or completely drowned out. And that if their voice is not heard, that has really serious implications as to their ability to have their questions and concerns responded to, but also to influence the response. So I think we need to ask ourselves sometimes in the way that we listen to rumors, what are our limitations and whether our approach is contributing to existing inequalities. So who are we listening to, and what does that mean in the wider context of who has power in this situation? So again, happy to echo what has been said in the previous presentation, that it's so important to try and gather from multiple sources if you can, online and offline, and understanding the implications of each. Be very open about those limitations. Don't generalize about what an entire community thinks based on social media data, for example. In the Rooted in Trust project, we worked with a few different ways. So for example, in Afghanistan, of course, we looked online, but we also worked with an organization called Salam Watanda, which is a national network of radio stations. And we trained female radio producers to go and have community discussions with women in the places where they lived and to collect their questions and concerns around COVID-19. In the Philippines, we were working in the BAM region, and we worked with an organization called CMYM, who were going into very remote regions that didn't have any telephone network or internet, and they would run community sessions with the community there to talk to them about misinformation, to share information, but also just to keep an ear to the ground as to what they had been hearing out there and what were some of the rumors that might be circulating. And in Sudan, we worked with an organization called YPO, who ran fabulous community events, again, in minority languages and in really remote areas. We also worked with local media as well to funnel the rumors as well that they were hearing through their talkback callers and their audience. So you might want to consider some methods like that, but you might want to also consider manual data collection if you have a really specific group that you want to listen to, like we had in the Rooted in Trust project. We've been piloting an approach that we're calling social media influence mapping. It's very simple. It's a fancy name for something that is very simple. It's a very low-tech solution. It involves basically deciding which demographic or vulnerable group you want to listen to, working with people from those communities, key, of course, and identifying how they use social media. Were there particular Facebook groups or platforms that are preferred by these users, where are discussions happening, and then if they are in closed spaces, so they might be in closed WhatsApp groups or private Facebook groups, ethically and openly requesting access to those groups to not only collect rumors that are being circulated, but to act also as an engagement tool. So to be able to share information, to respond to rumors and have non-confrontational, of course, discussions with people to try and meet some of those information needs, so that we're not just taking the rumors from the community, we can try and address some straight away while we're already there. So again,
1
instead
minute
of
warning, Irene. Sorry about that. Just 1 minute warning.
Yep, sure, no problem. So just next slide, thanks. So I'll zoom through this last bit, and I am almost done, I promise. But of course, trust is really important. And it's a bit controversial to say, but your facts don't matter unless they're delivered by someone the community trusts. Not that they don't matter at all, but people are much more likely to listen, engage with information if it comes from someone that they trust. And again, that's about people needing to find shortcuts. There is too much information out there at the moment. And these little shortcuts about trusting particular people and receiving that information is one way that humans naturally try and filter when there is much more information than they could possibly absorb. But what we found in our project was that trust is really dynamic. On one hand, of course, you can't assume that you're trusted. Even if you were trusted by that community before, you might not be trusted for health information, and that there's a difference between relying on an information source because you don't have a better option and trusting it. So in several communities where we were working, we saw high incidences of them, for example, relying on community leaders, for example, for information, but not necessarily trusting the information that they shared. We also saw that echoed in some communities with religious leaders relying and very regularly going to them for information, but not necessarily trusting it. And that community and proximity are not always the same thing. People will find their community where they feel comfortable. So for example, in Colombia, with the LGBTQ community we're working with, they were not sourcing their information from local community or information influencers. Their community was through YouTube. So I'll just go to the last slide, please. Great. So we have a long way to go to the end of this pandemic. I think we all know this. We have issues of vaccine inequality to deal with and vaccine hesitancy. There's been a lot of focus on hesitancy, but I think for many of the locations where we were working, access is just so low for people that's the greater barrier. There's people are open to having a vaccine, they just don't have one to have. And that's where us as communicators need to really think about how we communicate about this uncertainty. We need to get a little bit better about saying, I don't know when, for example, you will receive your vaccine, but this is why, and communicating around these gray areas. And that's a place where I think we feel very uncomfortable. We like speaking in certainties, but sometimes this space of uncertainty and being able to communicate about it openly is a way for us also to build trust with communities. And of course, to listen to the community and just continue listening. I will end it there.
Thank you very much, Irene, and thank you to all of the speakers. We have just a couple minutes for questions, so I will ask the presenters to turn their cameras back on. I think we've had several overlapping questions from several folks. So just to pick out a couple questions that we can ask, I think one thing that we all wonder about is that oftentimes our gut reaction when we see rumors and misinformation is to reject and correct those misperceptions, but acknowledge that this can lead to backfiring. Another presenter felt that we should correct false and incorrect information, but what's really the thing to do here? How do we, reconcile these two sort of competing notions? And feel free, anyone, to respond.
I'm happy to respond really briefly. I think from our perspective, what we found works really well is, yes, of course, respond to misinformation when you see it, but do that with empathy. So try and understand why someone might have come to that conclusion. And again, not necessarily demonizing them or, of course, using terms like anti-vaxxer or making them, otherizing them, as it's called. So trying to think from a place of empathy about how they might have come to that conclusion, and to speak on their level to give them information that might be able to help them to understand the situation more clearly.
And if I could just jump in as well, I think it's important to take a step back and think about how what people believe may affect their behavior. I had some really interesting interviews where people talked about a rumor that Ebola had come to Sierra Leone through a Spirit plane that had crashed. And rather than trying to reject that belief, the person explained to me that they just explained that the Spirit as what we call the Ebola virus is what you call the Spirit plane. And these are the ways that you can avoid the Spirit catching you. So in that way, the beliefs were still respected, but the behavior change goals were met, or were moved towards meeting. So.
Thank you for those responses. I think several of the questions that we saw in the chat have been answered throughout some of the discussions. However, one that I saw us come back to and was talked about briefly in some of the discussions as well was around this idea of knowing when and how we've succeeded in addressing rumors. So, how have, in some of our projects, we've been able to assess whether the action that was taken has successfully addressed the rumors? And then in a related question, how do we know that the rumor is no longer a concern?
So for our system, it was, rumor management is so complex, and it is so difficult to trace, changes in beliefs or attitudes over time back to a particular action that was taken when there's so many partners, so many different communication messages. And it was really outside the scope of our project to do some sort of impact evaluation or something like that. However, we do have kind of we can look at trends over time in topics. We can see kind of when things peak and when they taper off. And we have used mobile surveys to kind of track the beliefs over time and try to look at intersections or triangulate that data. So that's kind of the best I can offer there.
Would anyone else like to add to that?
Sure. Yeah, I think this is definitely the $99 million question for anyone working in rumor response. It's very hard to, tie your specific action to a specific result in terms of people's beliefs around rumors. But I think as long as we try and view it as a group effort, it's very hard to, even though we might see a shift in data that says that now people aren't talking about a particular rumor, that might be because that rumor has disappeared, or it might just be that the community is now interested in talking about something else and that rumor is still lying in the background. So it's very difficult. There are small ways that we've tried to do it as well, in terms of looking at the content that we might produce and talking to people before and after they've received it to see if it's changed their perception. But I think that's also why it's just really important to make sure your rumor management is a coordinated effort, that for all the organizations that are working in your particular context, that you try and coordinate as much as you can the information that you're sharing, and make it a group effort. It doesn't need to be about one organization conquering all the rumors. It's about, at the end of the day, making sure the community has what they need.
And I would also just add to that part of what's difficult to know is that people communicate rumors for different reasons. So sometimes they may be communicating a rumor and they don't actually believe it, but they're communicating it just to check whether it's true or not, where there's others that people are communicating and they really do believe. And so there's a lot of nuance that I think is really challenging to try to capture in rumor tracking, because it is the reasons that people share rumors and create rumors is really complex.
Thank you for that addition. I think what I keep hearing a central theme to responding to these rumors is empathy. And I appreciate that empathy is really coming to the front and center in the response. So thank you all. And I note that it's a couple of minutes over time, and we really want to respect everyone's time here. So we would just like to give a huge, sincere thanks to all of the presenters today. We know what a busy time this is for all of you. We have folks joining us from all over the world, including Australia. So we really, really appreciate you joining us today for this really important conversation. So thank you all. Thank you all of the attendees. Be sure to watch out for future Springboard events, and be sure to watch out for our recap email, which will include all the presentations as well as links to the recordings. All right, thank you.